Hello, I'm Dr. Bob Kenovan from the Avalon Clinic.
Hello, I'm Teresa. I'm a clinic nurse here at the Avalon Clinic.
And what we're talking about today is 21 days after surgery. And before we get into that, I just want to say Dr. Mark Zilmer told me about a BBC program that's called Me and My Breast that he said was very good and covers 4 different women with different approaches to dealing with their breasts. So he highly recommended it, and I'll trust him and say that it may be worth seeing.
Interesting. So, Dr. Kenovan, tell me about 21 days after surgery.
Okay. 21 days after surgery, I think there's basically 2 main things taking place. Number 1, on the outer layer of skin, what I call the bark layer of skin, it's sealed. It's protected, it's complete, and it's sealed. And inside that is the scar formation. And at this point in time, the scar's starting to get stronger. It's still weak.
Okay, so the scar is still weak at that point. Tell
Correct.
me about the scar.
Okay, so at 21 days, the scar is almost always still very red. There's a lot of blood vessels that are there. The strength of the scar is getting stronger, yet it is still weak. The sutures on the outside have been removed, and in almost always anyway, and on the inside, the sutures that are inside, the dissolving stitches are starting to dissolve.
Oh, okay.
So, Teresa, what do we tell our patients to avoid at this point in time?
We're still recommending that our patients avoid any vigorous exercise, any heavy lifting, pushing, pulling over 25 pounds.
And we were going to talk about tanning a little bit.
We were. We definitely recommend not tanning for the first 6 months after surgery.
And if they tan, sometimes they can cover the scar so it's protected, and then they can tan.
Yes, with a garment, yes.
Yes, or even tape or something like that.
Sunblock.
Only a very strong sunblock.
Yes.
Yes, okay. And what can they do at this point in time?
They can pretty much do anything. Getting back to normal. Definitely.
Except for vigorous exercise.
Yes, except for the vigorous exercise. Yes.
Okay. And you were going to talk about the use of bio oil.
Oh, yes. We recommend bio oil for the incisions. It absorbs very well into the skin, and it's fairly inexpensive and is easy to find.
Mm-hmm. And you can get it at most pharmacies,
yes.
You said.
Mm-hmm.
Okay. And at this point of 21 days after surgery, what is the risks that are still present for them?
As far as risks, the incision is still weak at that point. It isn't fully formed, so just still protecting the incision at that point.
Mm-hmm. So again, vigorous exercise, the wound, there's some danger to the wound.
Yes.
Okay. And what can they expect at this point in time?
They can expect that the incision is doing well, healing, starting to fade.
Right, and they're starting to resume their normal activities,
yes.
And the redness is starting to fade, as
yes.
you said.
Mm-hmm.
Okay, and if there's one point we want to make here, what comes up for you?
I would say just still protecting your incision at that point. It's still weak.
Mm-hmm. And still not overdoing it, but realize that in a few weeks you'll be about doing your normal things.
Enjoying the new you.
Yeah,
Okay.
got it. Thank you.
Thank you.